Thank you. Great to be here. So I think we're all familiar with the concepts of psychological stress, right? Even though it's something that, as scientists, we have a difficult time defining, it's something that's very familiar to all of us. And we're also familiar with how when we're stressed out, we're more likely to experience a little sniffle and a cold or maybe a tummy ache. But it turns out, work suggests that long periods of psychological stress, over, say, multiple years, are risk factors for the development of certain chronic illnesses. Things like cardiovascular disease, type 2 diabetes, and psychiatric illnesses like major depression. So as a biological psychologist, I'm very interested in what connects stress to health. And I'm also interested in novel ways to intervene to make us healthier people in stressful situations. So when most people think of stress biology, they think of stuff like cortisol and norepinephrine. But here on the screen is an immune cell, in particular a macrophage, which is a part of the inflammatory response. John Doyle talked about this yesterday. And we know now that stress activates this cell type, activates the inflammatory response as much as it does other things like cortisol. And so in my lab at Emory, we study stress by putting people into a situation like this, and we ask them to give a public speech that, ironically enough, is supposed to last exactly 5 minutes. So there's kind of an eerie similarity to what I'm doing right here. It's maybe payback for all of the people I put through this procedure. But what we do is we draw blood samples every 15 minutes, and along with things like cortisol and norepinephrine going up, we find that in healthy people, basically you and me, there's an increase in these key inflammatory mediators. And you may wonder why we would have an inflammatory response. It's probably because back in the days when our stress response systems were being fine-tuned, by evolutionary pressure, it was good to have an inflammatory response because your skin would maybe be torn open when you were in a psychological stressor. Today, that's not so much the case. And in fact, the stress response system, especially this inflammatory response, is kind of a fish out of water. So when we put unhealthy people through this same public speech challenge, they hyper-react in terms of their inflammatory system. So these are depressed patients. You can substitute patients with type 2 diabetes in there, and even certain patients with cardiovascular disease, you see the same type of thing. So we've used this information to try best how to intervene. So I have colleagues who are interested in targeting the inflammatory response with really powerful anti-inflammatory compounds. I want to do that instead, from a top-down perspective, using a meditation technique, something that's called cognitively based compassion training, developed by one of my close colleagues at Emory, Lobsang Tenzin Negi. Compassion, or cognitively based compassion training, is derived from Tibetan Buddhist compassion meditation. And it's a program that's quite unlike things like mindfulness or other non-analytical meditation techniques. It's something that's very cognitive in nature. It really makes us explore our feelings and our actions for others that we often don't deal with. And the ultimate goal of cognitively based compassion training is to really foster improved emotional empathy, emotional intelligence, and really emotional regulation, and also to help people be better at managing conflicts. So when we put people through an 8-week standard program of cognitively based compassion training, we find that they tend to exhibit lower inflammatory activation. But what's really cool is the people who practice the technique quite a bit, so on the x-axis is increasing practice time, there's a reduction in their inflammatory response to the same stressor that I just was telling you about, that public speaking task. It's important to point out that that public speaking task really evokes a powerful feeling of social evaluation, this social evaluative threat. Now, I'm not really feeling that so much now, or maybe I am, but that's something that we believe that cognitively based compassion training and compassion meditation in particular may help people to respond more appropriately to. And so we've extended this work in more recent years to foster care children in the Atlanta area. And so you may not know, but foster care children often have experienced some sort of early life adversity, abuse, or neglect types of situations. We know those sorts of experiences lead to increased inflammatory system activation in adulthood. We also know that those experiences make people more likely to experience things like cardiovascular disease, type 2 diabetes earlier in life. So in this particular study, we simply put the kids through 8 weeks of the compassion meditation, and we found a similar type of thing. The more that they practiced, the more their inflammatory response was reduced from before to after the training program. And so our ongoing work now is delivering cognitively based compassion training in foster care, group foster care homes, to see if we can associate changes in these inflammatory markers with changes in behavior and changes in how a group functions together. So thank you very much.